Live. And we'll give that just a few seconds to make sure all the technology is connecting. And I'd like to welcome everybody back to Alabama Care. Today we have Mrs. Susan Sellers, United Ability CEO, and Dr. John B. Waits, Cahaba Medical Care CEO. And we're going to be talking about the new partnership that both organizations have here at United Ability at the Ability Clinic. At this point, I'd like to hand it over. Mrs. Susan Sellers, if you would introduce yourself.
Good morning, Alex. Thank you for having us this morning. We're really excited to share with you and all the viewers a little bit of information about this new partnership at the Ability Clinic. As you said, I'm the CEO at United Ability, which is a 75-year-old nonprofit organization serving more than 5,500 individuals with disabilities each year through a variety of programs that really crosses the entire life spectrum, from point of diagnosis with a disability through balance of life.
Well, thank you for having us. I appreciate that. It's a beautiful campus here. We've been on campus numerous times. And the Ability Clinic here is kind of at the back part of the campus. So when you guys come to United Ability, keep on driving. You'll see the Link Point building on the left and administration on the right. And keep on going. You'll get back to the Hands in Hands in the Ability Clinic. At this point, Dr. Waits, if you would introduce yourself.
Sure. Yeah. John Waits. I'm a family physician by training. I have the privilege of serving as the CEO of Cahaba Medical Care. Cahaba Medical Care is a nonprofit community health center. We have 24 locations. We took care of 31,000 people this past year. Half of our organization is in rural counties to the south of Birmingham, and half the organization is in Jefferson County with numerous primary care clinics and dental clinics around the western side of Jefferson County in Birmingham and Bessemer.
Thank you for being here with us again. You mentioned rural. A lot of your offices are in rural areas, and that's kind of something that we've seen over the pandemic. I've heard instances where hospitals are getting shut down in rural areas, and there's a need for healthcare in kind of more rural areas. Are you seeing that in your practice?
Yeah, absolutely. Some of the rural communities that we're in have had hospitals shut down over the past few decades, and that has definitely been an epidemic in Alabama in particular.
Yeah, it's hard to see that when there's a need, and there is such a need for especially healthcare, but then healthcare in the disability community to keep growing there. So why this new partnership? So we have both organizations partnering, having healthcare here at United Ability. What is the void that this new partnership is filling, and why is it needed?
Well, the partnership is really just the coming together of two organizations that have similar missions serving a similar population. Two organizations that also have as part of their mission providing holistic care. And so that's really what brought us together. Federally qualified health centers were established to serve marginalized populations, serve individuals on Medicaid, individuals with disabilities. And so the fact that United Ability was here and already had a clinic in place, but really wanted to build out that clinic so it would become a true medical home for individuals with disabilities by providing primary care services and behavioral health care services, in addition to all the other services that we already provided, just made complete sense.
From our standpoint as a community health center, defragmenting healthcare is one of the things that we do best. From primary care, from the beginning of life to the end of life, from integrated behavioral health care, counseling, case management in amongst that primary care. We are a patient-centered medical home, and families with disability are a part of that. One of the things that was really attractive about this relationship is you guys are the experts. And so us coming together and being able to provide the primary care, the behavioral health, in time, dental and nutrition and some of the other things that any family would need in a patient-centered medical home. This is a partnership that we've been working on and wanted to have.
So the Ability Clinic has been around for a number of years. My aunt received services through the Ability Clinic, but there are some services that she couldn't get, like primary care, in years past. And so this partnership, as you mentioned, is bringing a more holistic approach of individuals with disabilities can get a whole spectrum of services here at United Ability and Ability Clinic, whether that's through the whole lifespan, through birth and early infancy there, all the way through old age right here on the campus. So you guys are partnering and allowing individuals and families to kind of have a one-stop shop almost. Yes. You say defragmenting healthcare. That's kind of a buzzword. What does that mean?
Well, let me, let's say you're just an individual who is going to see a primary care physician, and you have a cough. There's something that shows up on the X-ray, and we need the second opinion or expertise of a pulmonologist. Well, in the course of that workup, you find something going on with your kidneys, and before you know it, there's 3 or 4 specialists whose second opinion you needed at one point. Maybe you needed a procedure. But in time, you've accumulated a number of people who all have a different piece of your healthcare pie, so to speak, and it's helpful to have a quarterback coordinating all of those different elements. This is before you even introduce, a family with something as complex as a disability. This is just kind of, primary care where complications arise in one or more of your body systems. So family medicine, pediatrics, internal medicine, the primary care specialty is one of the things that when we're on our game, we will defragment that, help get people connected, make sure tests aren't repeated that are unnecessary, make sure communication is getting with other people. Now, add in the complexity of a family dealing with disabilities, and the need for communication is up an order of magnitude. So.
And I think a lot of times, sometimes it can be overwhelming for the family. It's a lot of new jargon, new terms, and it's almost like they have to get a new degree in what all of this means and go and research that. So kind of being under one roof and working together as partners, you can, like you said, quarterback that, where if the family or the individual has questions, the file might be, right here, everything's linked to it. The doctor might be right down the hall. We can ask that question today, get that figured out.
For better or for worse, after you going to a specialist and you've got the expert there in front of you, it's so common in primary care for a patient or family to come back and say, now tell me what they said.
Yeah.
And that integrated care model really speaks to all of that too, because you have social workers that are here on campus to try to help with that jargon, to try to help families access the benefits that are available to them and navigate through that. So it's not all on the physician, who has to explain all that, or the nurse clinicians, et cetera, but you have a social worker who's here to also help the family navigate that entire process.
And I think it's some of the environment too. So coming here, you may see other families that are going through the same thing. When if you're going to a bigger hospital, you may be the only one in that waiting room that has a disability or a family with a disability, and you might feel kind of outcast or just not welcome as much. When here you could have the experience of maybe the family that's in the waiting room with you is going through the same challenges. So I think that's a big thing. That would be a motivating factor for me to want to receive services here, is being around others, because you never know what comes out of those conversations. And you could meet a friend for life, and you really need that peer support in the disability community.
Absolutely. And, if you think about children in particular in the pediatric waiting room, we had a beloved receptionist that retired recently who had a limb deficiency, and I can't tell you how many times I would come in the front doors of the clinic and she would be sitting there with a parent and a child with a limb deficiency, showing them her limb deficiency, taking off her shoe, and it just immediately, made the family and the child so comfortable and feel welcome. Well, think about, if you're a child and you're surrounded by other children that all have unique abilities, how that makes you feel like you're, just like everybody else.
And as you guys can see a little bit in the background here, there are kids out there with all different abilities, just having the time of their life, on the playgrounds, doing activities out there together. So it's a very welcoming environment here. And I was hoping to be able to show some of that going on. Now, we spoke a little bit about, healthcare and receiving services. Is there a difference between healthcare for an able-bodied family versus family with a disability?
I think there's differences and there's similarities. I mean, certainly the similarities are that everybody needs somebody to help interpret what all's going on with their different specialists, like we discussed. Similarities, the human body is the human body. And, people, no matter what their physical disability might be, might get a respiratory infection. But then there's comorbidities, and there's things to watch out for and red flags that happen with those comorbidities. The disabilities are one that it takes a little bit of expertise and familiarity in that environment to get expert at that.
Do you notice that there are more comorbidities in the disability community, as in you see more links there?
I don't know how to weight more. There definitely are, but there's other disease processes that can have comorbidities as well.
Some of the other things that I think are a little bit different. I know with my family member, when we go to see the doctor, she does not like her blood taken, or and she goes to Sparks Dental, she does not like people in her mouth, and you kind of have to have that patience. To work with the individual, because she doesn't understand why you want her blood.
That's right.
And I can talk her through that process and kind of coach her through that. But are there trainings for doctors are there additional trainings for doctors when working with the disability community?
Well, that's one of the best things about this new partnership. Another thing that's always been really important to United Ability is that we have individuals in medical school and nursing school and students all the time here on campus in hopes that they will learn more about what it would be like to care for an individual with a disability, so that they're comfortable as having that as a significant component of their practice. And so Cahaba actually has a family practice residency program, 36 residents. And so a huge part of this relationship too is that those residents, the majority of whom continue to practice medicine in Alabama and in those rural communities that you were talking about, Alex, where so oftentimes it's difficult for an individual with a disability to get access to good care. They will be rotating through the Ability Clinic, pediatric and adult, so that they're exposed to a lot of those different health concerns, comorbidities that these individuals might have, so that they are comfortable when they start their own medical practice in caring for these individuals.
Now, is that a requirement? Is that like a federal requirement that you have to do that?
It's not a requirement for primary care. And what's so powerful about what Susan's describing is we do have exposure to disabilities in our medical training. It's just not as coordinated. And maybe it's a little haphazard. Maybe you have a long-term relationship with a family with a disability at some point in your primary care training, or maybe it happens in passing. But what will happen for our medical students, our residents, nurse practitioner students, PA students, as they come through, they'll be able to see some of the best practices happening, some of the patients that you're describing, some of the, this is not a child being obstinate, this is fear, this is what fear looks like in this context, and just kind of knowing how to deal with that. As you said, we got 36 residents now, we have 20 coming in each year, and they spread all over the state of Alabama. And they'll just be that much more comfortable. A provider will get nervous with something they're unfamiliar with. So when there's familiarity and expertise, it's going to be that much better care.
Yeah, go ahead.
I was going to say, it's also why part of the Ability Clinic is that we have a partnership with the School of Optometry at UAB, and that those professors and students do adult and pediatric optometry clinics here. So again, getting these students while they're in their training comfortable with what is it like to do an eye exam on an individual with a disability like your aunt, as you described, who, that's for all of us to have someone put that right up against your eye can be a little bit intimidating. So let's, while you're in training, let's see what are some of the best ways to approach that, and how do you work with these individuals? And so again, that when they go out and are in practice, that they are happy and willing and, more importantly, comfortable in caring for them.
It's a societal change. I mean, it goes to speak to the inclusive childcare that you have here, where you have children of all different abilities learning with each other and getting that experience, and that'll help break down some of those fears that some people have later in life, just not having experienced other abilities. So I think it's awesome that it's not a requirement, which I think it should be for all doctors to go through some type of training like this and experience like this, but you guys have a funnel of new residents that may not work with Cahaba Medical Care, or they may after their residency.
Right.
But part of that experience and part of the partnership that you guys is having them get in and care for, provide health care for individuals, children with different abilities there, and get that experience. So congratulations. That's a societal change that'll
Yeah.
be.
Well, and it's, we're seeing it not just with Cahaba, but we had 180 UAB medical students here the week before Thanksgiving for exactly this purpose with our adult program, interacting with and talking to our adults, interviewing our adults about what would you like to see from a physician? How would you like your doctor to treat you? And these students are asking those questions and hearing that feedback directly from the adults. And, hats off to those faculty members that did make that a requirement for those medical students, which was, just tremendous. And we have had Sanford nursing students here all fall coming in every week and working with our adults again, so that the nursing students have the opportunity to interact with, be exposed to, and learn from these individuals and these participants.
Yeah, and they'll carry that forward, because a lot of times
Absolutely.
some people will get nervous if they don't have experience with certain types of clients or new clients, and so breaking down those barriers and giving opportunity there will carry on. So congratulations once again. Now let's talk a little bit about the ages served through the Ability Clinic and the continuity of care that's provided there. So how young can someone get involved in the Ability Clinic?
I mean, really pre-birth.
Prenatal. Yeah.
Prenatal. I mean, if a mom learns that she is going to have a child with a disability, she can come and meet with Dr. Head before the child is born and talk about that child's care here at Ability Clinic, then all the way through what we say is balance of life.
Mm-hmm. Balance of life, that's the first time I'm hearing that one.
Yeah.
And so you can come pre-birth and kind of get prepped for that. Maybe some new mothers are unsure of how that goes, or fathers, and just that whole experience. And then all the way through young life, all the way through school, transitioning out of school, and then long-term care. So really for individuals and families, you can think of this as once you get into the system, kind of in the Ability Clinic, you no longer have to worry about where your next healthcare provider is going to come from.
Correct.
Build a good relationship early on. And then I know a big fear for a lot of parents is what happens after I'm gone. And so you want to start building these long-term relationships so that your son or daughter knows who their doctor is or where they're getting their health care. It's not something new to them. And they don't have to constantly be going to a bunch of different areas or hospitals. They can come to the same place they're used to, the same relationships, and get that care throughout the entirety of their life.
I
Correct.
think you described it perfect. Yeah. Nobody's ever forced out.
No, absolutely. Yeah.
So there are other organizations in Birmingham, such as like Children's and the STEP program. How does one distinguish the Ability Clinic from some other organizations that provide health care?
I think the biggest thing to say is that the need is so great for integrated patient-centered medical homes for anybody in primary care in the state of Alabama, but especially the disability community, that there's just it's a collaborative effort amongst all of us. There's ways in which we collaborate with our various specialists that come on site. There's also one distinguishing feature, like we already discussed, is that this is a place where, from the diagnosis to the balance of life, that you can be cared for here on campus. But this is a collaborative team effort, really.
And the clinicians that are here all day, every day, what these clinicians are doing is serving individuals with disabilities. That's all they do. That's their entire practice, which is also similar to what it is, at the STEP clinic. But we're partnering with the STEP clinic and with UAB HSF's physicians that work at Children's and Rehab Medicine. Those are the rehab medicine providers here at Ability Clinic also. So we're really collaborators and partners as well.
Yeah, if there's a need, and it sounds like there is, especially in the disability community for healthcare, we want to provide it. And
right.
That looks like more partnership and more hands on deck, so to say. So let's talk a little bit about some of the new services that are going to be available at the Ability Clinic with this new partnership. One is primary care. If you talk a little bit about that, just for anybody that's unfamiliar with that term.
So primary care, you think of family medicine, internal medicine, pediatrics, and so Dr. Lynzee Head is a pediatrician. She's here the whole week now. The primary care side of things is open 5 days a week. Campbell Scott, a nurse practitioner that works in collaboration with her. She's here 5 days a week. She sees kids and adults. So that's primary care. We've also got behavioral health.
Oh, yeah. So talk a little bit about behavioral. What exactly does that mean, and what does that look like when it's one-on-one?
So behavioral health is mental health counseling. So it looks a couple of different ways, the way that we kind of deploy it at Cahaba Medical Care. There's integration. So integrated behavioral health means that there's a counselor who's on standby when the primary care provider needs some additional coaching. They just decide the family needs some additional help right then that day. So there's that integration, but there's also time for scheduled counseling appointments. They're a little more intensive time. The integration is a little bit of a shorter intervention, a brief assessment, and then there's scheduled counseling. And then I guess the third piece of that integration is case management. Sometimes it's not counseling that's needed. It's like, how do I navigate the healthcare system with this durable medical equipment, with affording my copay, or any of those sorts of things. So
yeah.
Anything to add? I know.
Well, I was just going to say, when I first came here, Alex, I spent a lot of time in the different programs, and I spent a lot of time in outpatient therapy, just trying to learn more about who we are and what we do. And I remember telling some of our therapists, it is so challenging to be a family member and a caretaker sometimes of an individual with a disability. And I feel like half the time you're providing therapy to the participant, but the other half of the time you're providing counseling and therapy to the caretaker, because it's exhausting. And so to know now that there's a home for those family members too, the Ability Clinic serves individuals with disabilities and their families. Right. I already can think of several instances here on the pediatric side of the clinic where we have had family members here with a child. Maybe they receive a difficult diagnosis while they're here about their child's health, and they have been able to meet with a counselor right away, just right while they were here, the parent, because they were really struggling and going through a difficult time. And so to not have to figure out, now what am I going to do, because I need to take care of myself so that I can take care of this loved one, all of that again is just right here.
Yeah, I didn't know that was available. So you can be a family member and still receive services. Yes. Therapy services, counseling services,
or primary care. Say it's so there's multiple siblings and it's a difficult visit. Well, that could be coordinated. That primary care can be coordinated.
Do you have to be a member of United Ability to receive Ability Clinic services?
No.
So it's open to the public.
Yeah, anyone with a disability.
Okay.
And their family members. Yeah.
And their family members.
And their family members. So even if you're not in the United Ability system, you can still reach out and ask for care and get into the system that way.
Our hope is that, some of the residential homes, some of the group home providers will transport, their residents here for clinics. And we really want to be that medical home for all individuals with disabilities. So it's not limited to United Ability participants at all.
Where if you have individuals that are staying with each other, maybe a couple are roommates where they could all come on the same day, and kind of get everything done that they need to get done.
Absolutely.
It sounded almost like emergency services in the behavioral ER services for counseling. Like if you're going through something and you're having a really tough time, you can call up and talk to somebody. Is that available? If the staff is available.
Yeah, if the staff's available.
Sure.
You never know what's going on the ground, if you're talking about telephone.
Yeah, but when you're talking about being in the room and the parents needing a little guidance and coaching there.
Yeah.
If there's somebody available, let's do it right now.
Exactly. That's exactly what we did. Yeah, I know.
One of the big things that is talked about is dental and oral hygiene here in Alabama. Now, it's something that's not typically covered under Medicaid there, and we have to come out of pocket for my end. Is that something that's going to be taken? Is oral hygiene going to be something at Ability Clinic?
Absolutely. It's not something we've started with. So Cahaba Medical Care, 2 of our locations are dental clinics. One of them is in Birmingham. And we feel the same pain of, it is not a covered service for many of our adult neighbors. But this is something important that we want to get accomplished. So we've kind of made plans in our walkarounds to have that happen. And I think we've had some patients already transported
We
to the
have,
clinic.
and we've scheduled, clinic for the adults that are in our adult day program at Link Point to transport a small group of them to the dental clinic so that they could. So those clinics are scheduled out once a month. So.
Yeah, it seems like such an important part of healthcare because I hear about
It is.
gut health and everything coming from
the
your
gateway
mouth.
to
Yeah, and it seems like maybe some of these long-term ailments can start in the mouth and then travel into the body there. So it would seem like from an insurance standpoint, you'd want to start just like early intervention. You'd want to start early. You'd want to start in the mouth, and it doesn't make sense to me why insurance doesn't have that on that. Here.
Seems like a problem we could solve to get some basic dental coverage and parse out whatever's cosmetic. But yeah, I'm of your opinion. Yeah.
And pre-COVID, we had a dental clinic here also for the adults.
Okay.
That obviously that stopped during the pandemic, during the scarier days of the pandemic, I guess. But with the partnership with Cahaba, our exam room, our dental clinic, didn't have running water underground, and because they have 2 freestanding dental clinics that do nothing but that, it just made sense that we would partner with their clinics instead of trying to reestablish it.
No, that's kind of a hot topic. It's tough to find good dental in disability for providers that are open to it. So to have that here is one-stop shop again.
Yeah.
Now we're talking about insurance not covering some of these things like dental. What is the cost to the consumer coming to the Ability Clinic and getting services?
Well, that's a question that's nuanced. It depends on what's needed. But if someone doesn't have insurance coverage, there's a sliding fee discount schedule that so reception, working with our billing department and our case manager will work with them and slide them on basically on their ability to pay. We'll figure out what rate.
But you're not turning people away for not having insurance.
Nobody's turned away because they're unable to pay.
Yeah.
Even if they can't afford their copay, there's a way to put that on the slide if the income justifies it. So.
And that's the heart and soul of FQHCs.
Yeah.
I mean, that's a huge part of why they were established when they were established, is because the federal government recognized and acknowledged the fact that people weren't getting access to primary care because of exactly that. So the FQHCs were established to help address that.
FQHC.
Federally qualified health clinic or community health center, which is what Cahaba Medical Care is.
Okay, I got you. So no matter what the situation is financially, if you need the service, you can get that service here at United Ability and at the Ability Clinic.
Right.
You're not going to be turned away. It's important to get, if there's something lingering and you're like, I'm not sure if I want to go see the doctor. I don't know how much this is going to cost, those types of things. Don't worry about that. Get in the door. Let's figure this out. We can go from there. Let's get the help you need first.
Yes.
How many days of the week can I see somebody here at Ability Clinic? How many days are we open? Are there specific hours?
5 days a week. Normal working hours, 5 days a week.
Are there 24-hour services?
There's a 24-hour phone line. Yeah, so Cahaba Medical Care has a 24-hour phone line. We've got physicians that are on call.
I'd like to go through some examples. So I think our audience really appreciates kind of examples and what they picture that looking like. So if we could go through some examples of what healthcare looks like at the Ability Clinic between the ages of 2 and 10. So kind of young there.
I think about, and I've always been a working mom. I mean, I've always worked ever since I had children. And what a struggle it is, whether you work outside of the home or your full-time job is inside the home. When you have to go to multiple locations for all of your appointments, that's hard. And you can imagine, especially if you're doing that, if you have a child that's in a wheelchair, how cumbersome that can be because you have to go somewhere different for every type of appointment. But here, and I have met many parents and caregivers in the parking lot already that have said, I am so excited because we just had speech, physical therapy, OT, and we got to see Dr. Head and get our flu shot all in once. I only had
And
to
their
take off work.
siblings.
Yeah, and their siblings, right. And I only had to take off work this, one morning, and we were able to get all of that done at once. And durable medical equipment. Biotech is here 1 full day a week, every single week of the year. And so it's nothing to see the therapist and Dr. Head and biotech all in the room together looking at the child's breast. So just think about if you could get all of that done in that one stop in a building that's easy to park in, just a flat lot, easily accessible to unload, and everything can be taken care of at one time in one location.
I imagine for a family of 5, let's say you got 3 or 4 kids, if you were to add up, maybe there's 5 to 10 doctor's visits for the entire family. That's almost like a week's worth of driving, sitting in waiting rooms, getting the care, then going to the next appointment. So you're thinking about a whole 40 hours, basically. It's a work week that you can reduce that time to maybe an afternoon.
Absolutely.
Or maybe a morning.
And think about,
It's a life hack.
It is. And think about the early learning program, which you've already referenced. I mean, we have 141 children ages 6 weeks to 5 years old on our campus every single day in our early learning program. So teachers are calling and saying, I'm sorry, so-and-so has an earache, we need you to come pick them up. But you can go right next door and get an appointment with Dr. Head. You don't have to wait to get in, to the doctor. She can check you out right now before you even leave the campus when you come and pick them up.
Are there any other examples that really stick out of what the Ability Clinic is able to provide for all age ranges? Kind of open it up there.
I mean, I think the question
Beyond
is
what
more,
we've discussed.
Yeah, or what we can't provide. I mean, we're
I'm trying
not
to think.
specialists.
Yeah.
I mean, we have physiatry here, which is great, rehab medicine, which is wonderful.
Do you guys have an X-ray machine here on campus?
No, but we have a lab.
Yeah, so you can run in-home tests, kind of like that.
Yeah.
Now you mentioned one of the other programs in the background here and how they can receive services kind of in the next room over if they have an ear infection.
Right.
How is United Ability kind of onboarding everybody that's involved in United Ability with the Ability Clinic?
So we've been sending out, emails through Constant Contact, flyers, promoting it on social media, participating in media interviews like we're doing with you here today, which have been fantastic. We've kind of done all the first touches. Now we're going back to do the second, third, and fourth, because you may get an email, but that's not the day your child has an earache, and then you kind of forget about it, and then they call and say your child has an earache, and you think, oh wait, didn't I read something about maybe there's a clinic now? And so we're doing that. We're meeting with other disability providers in the community. We've shared the information with them, but now we're following up in one-on-one conversations about how can we serve you and the individuals that you serve in your organization as well. We're meeting with medical providers that more typically serve individuals with disabilities, like OB-GYNs that might already know of a patient that has a child with a diagnosis with a disability. So like we talked about, they could come in and meet with Dr. Head in advance, or NICUs, where you would tend to find, more children that might be more at risk of some type of developmental delay. Our early intervention programs, they're working with children ages 0 to 3 all across the state. We are fortunate enough to be the largest provider of those services in the state, but there are a lot of other EI providers across the greater Birmingham area and beyond as well. And so being sure that those early intervention providers know that they can refer children here and families here. Yeah. So lots of touch points.
Yeah, and it's almost
we just really want to get the word out.
It's kind of constant contact too, because your child might not have that ear infection that day. You're not even thinking about it.
That's right.
As long as you're in the conversation there and in the kind of in the background, when that ear infection pops up, it's like, going to ability clinic. I imagine another part of that too is kind of training staff to talk about it. Hey, when you're going to meeting with these families or something pops up, you're meeting other professionals, let them know that ability clinic, we can provide these additional services now, and getting them on board to be excited about it.
Right. I mean, because we serve over 5,500 unique individuals a year, we have to start in-house. That is the logical place to do that. So with all of our programs, we do a lot of work in the high schools with our employment department, employment services. We serve over 800 high school students a year through employment services. So just being sure that they know that it's available to them as well. So every program, that we conduct, making sure the families know.
It's a holistic approach, really. Anything throughout the course of your life, services, behavioral, healthcare, employment.
Therapy, which we've had for decades, but that's such an integral part of caring for the disability community. And so, again, all of that being right here where your therapist, our therapist office is right here upstairs in our medical clinic, so that those therapists can be part of those appointments also.
To integrate.
Yeah.
Are there any upcoming events that you would recommend individuals and families kind of attend, whether that's here at United Ability on campus or whether it's kind of an online training?
Well, March 4th is the Transitions Conference, and you were there last year,
Yes,
Alex, and we're so excited to partner with UAB Step Clinic and others again in that transition conference. So that's on Saturday, March 4th, and that for families that have a loved one that's transitioning from pediatric to the adult world in disabilities, that is a wonderful place for them to hear all about healthcare services and healthcare providers as they transition to adulthood, but also things like employment, housing, DME, all of those other things that are part of your life as you go from the school bus being at your house every single day for so many years to moving to adulthood. And so all of that will be covered there.
It was a great conference this past year, and you guys knock it out of the park every time, whether you're talking about employment or the transition in healthcare there. I know it's a big thing for families, kind of that maybe 18 to 25 range. There's a lot of change going on for anybody, moving out of the house, getting a job, those kinds of things.
And they'll also learn about all the adult waiver programs that their loved one might be eligible for as well, which is really important. So.
Awesome. As we wrap up here, is there anything that we haven't talked about that you think individuals and families could really benefit from hearing about United Ability and the Ability Clinic and Cahaba Medical Care?
I think we've covered a lot. It's a integrated primary care, behavioral health, therapy solution that's available for families with disabilities, and their families, the parents, the siblings. I think we've covered a lot of it. Anything?
I'm trying to remain calm, but we're so excited about it here. Just really, we have been working on this and planning this for a year. And, we have this wonderful graphic where we have the individual with a disability at the center, and we talk about all the wraparound services that are part of the Ability Clinic and United Ability, and all the things that, the things, the incredible team, support team that's needed to make sure that these individuals are thriving and that their families have access to the services that they need. And so it's all the things that Dr. Waits just mentioned, and then all the things that United Ability has traditionally provided to these families, again, for 75 years. So we talked about all the medical side of those things. We kind of mentioned a nutritionist. That's also part of it, which is, again, so critical. We have a feeding clinic, an outpatient feeding clinic here. A lot of times just swallowing and some of those things are a huge part of an individual's struggles. And so not only do we have the feeding clinic now, but we have a nutritionist that works with those families on meal planning and things like that. And then probably the other part that is is really instrumental about this. Alex is just everything that we do to support the family members outside of just the clinical services through our Ability Connections program. And that is the family outings so that everyone can be with families that have loved ones with disabilities, whether they're coming here next weekend for Breakfast with Santa, or whether they were at Glow Wild at the zoo a few weeks ago. All of those activities that we plan for them to come together and talk about and share. Our dad's group.
I was just going to say the dad's
monthly,
group. Yeah. Shout out to Lane.
Shout, absolutely. And to David Berry for organizing that here and just giving those dads their support network where they can talk about the healthcare struggles and all struggles, that they face as fathers of children with unique abilities, and our Mommy and Me groups. And so, there's just that whole support of it is part of this holistic model as well. And that's related to mental health. It's the social, emotional, physical, all of it in one place, caring for these individuals.
If you are a family that has a disability and you're not involved with United Ability, you need to get here because
come on.
Yeah, just the quantity and quality of services that you can receive over the course of a lifespan. You're in the system. I mean, you guys are set up to grow like crazy here in the next decade. How big is the campus here? Because you're going to have to build more buildings.
26 acres.
I
so
think
we've
you're
got
going
room to grow.
I think you're going to have to build some new buildings here in the near future.
We've got room to grow. But really it is, we want to be sure that everybody knows that it's not just for individuals currently served by United Ability. We are great partners, collaborators, and friends with other providers in this community. And so if you're attached to one of them and they don't offer medical services, then we'd love to see you here at United Ability and at the clinic.
And always welcome. So just pick up the phone and call, start the process.
Yep, that's all it is.
Well, I'd like to thank you both for spending some morning here with us and teaching us more about what the Ability Clinic and Cahaba Medical Care are partnering and able to provide.
Thank you.
Thanks so much.
Yeah.
And at this point, we'll go ahead and look at our respective cameras and we'll say we will see you guys next time.
See you next time.